Nearly half of U.S. states report cases of the new Omicron variant of COVID-19. This map shows them. Tennessee has yet to report a case of Omicron. 10 News reporter Cole Sullivan explains Tennessee also falls behind many other states in looking for that new variant. Cole?
Robin, for now, the Delta variant is the most common by far here in Tennessee, but 3 of our neighboring states report Omicron cases, and doctors say they wouldn't be surprised if it's already here, too. The head of Tennessee's Department of Health says Omicron will arrive here soon.
It's just a matter of time.
And the state is watching for it.
We take a portion of the positive samples that we get here in Tennessee, and we send those for genetic sequencing.
The standard COVID test detects whether a patient is positive for the virus, but it isn't advanced enough to tell which variant. For that, the sample must be analyzed by its genetic building blocks in labs like the one led by Vanderbilt Medical Center's Dr. Jonathan Schmitz.
This is something that needs to be done so we're not in the dark along the way this pandemic is evolving.
But Tennessee does not send as many samples to those labs, less than 2% according to CDC data. Compare that to Vermont, which tests 1 in 5 samples, or West Virginia, which tests nearly 1 in 10.
The more we can do, the better.
It takes time, from test to sequencing to analysis to detection of a new variant, can take days. He says it won't change your treatment if you test positive.
Whether or not you have Delta or Omicron or the original virus from 2 years ago, that doesn't impact necessarily the sort of care you're going to receive.
But it can help the state plan for where more cases and more hospitalizations may pop up.
On a level of figuring out where this epidemic is going, where we need to divert resources to, where we need to plan in the future, sequencing is quite important.
For now, Dr. Schmitz says most patients will never be notified which variant they have, even if it is Omicron. And the long term, and we're talking years here, Robin, the type of variant you have might determine which treatments doctors use. Back to you.
It is going to be interesting to see how this plays out, for sure. Cole, thanks.